Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to talk about cardiac nursing. Now this subject really resonates with me because since I became a nurse, I have done nothing but cardiac nursing. It is my passion and my love, and I absolutely love it. So in this video, I want to go over some things for you people who are considering this field. Maybe you want to go into cardiac nursing and what it has to offer. So what I want to talk about is what they do. I'm going to talk about my experience as a cardiac nurse, talk to you about the different types of cardiac nurses and what specialties you can go in, educational requirements, how I became one, any certifications you can get to help you get more pay, the salary information, and what I liked about it and what I don't like about it. So let's get started. First, what is a cardiac nurse? You know it has something to do with the heart, but what exactly do they do? Okay, what a cardiac nurse does is that they provide care to patients who have heart disease or heart problems. Some things are treatable, some things are not treatable. And we educate patients about their disease, how to manage it, their medications, how to properly take their meds, diet, how that can make it better. And we also, the fun part, what I love, is assisting the doctors and the nurse practitioners with diagnostic testing, such as transesophageal echoes, which are called TEs, where they go down through the throat and they look at the back of the heart. They're looking at the heart valves, the pumping function of the heart. It's a very awesome test to be part of. Stress tests, I did that for many years, running diagnostic tests with that with a nurse practitioner. Cardioversions, another fun, awesome thing. This is where if you have a patient in atrial fibrillation, we cardiovert them, meaning that we shock them and try to convert their heart back to normal sinus rhythm. Very awesome to do. And heart caths. This is where a patient goes in and they suspect a blockage, usually from a stress test that they had. It showed a suspected blockage. They go in, they shoot dye into the coronary arteries of the heart. They take imaging and they see how the blood flows to the heart and if there's a potential blockage. And if there's a blockage, they'll go in and stent that. So there are so many cool things that a cardiac nurse does. Now, let me talk a little bit about my experience as a cardiac nurse. Whenever I started out on a progressive care floor, which is an ICU step-down floor, and that was my first job. And we seen a whole wide variety of cardiac problems, from heart attacks to atrial fib to congestive heart failure. And we started performing, we were actually the first floor out of the whole hospital area to start performing aquapheresis, which was one of my favorite things to do. It's where you go, because whenever a person has congestive heart failure, their heart is weak, and so it doesn't pump blood efficiently, and they start having backup of fluid in their legs and their lungs, and they can't breathe. And the aquapheresis machine will go in through a central line and will, in a sense, just suck off that water, that extra water, and you get that out of their blood so they can start breathing better and moving around better. Awesome, and I love that. And then after that, I moved to non-invasive, where I worked in a stress lab where we did stress tests. We did chemical stress, exercise stress, we did transesophageal echoes, cardioversions, tilt table tests, stress echocardiograms. We placed cardiac monitors, and I absolutely loved it. So that's a little bit of my experience as a cardiac nurse. Now let's talk about the different types of cardiac nurses and what specialties they go into. Now this is just a little short list. There's a lot of other things, but I just wanted to hit the highlights. So say you're wanting to be a cardiac nurse. These are some things you might want to consider. Some hospitals have floors that are specifically heart transplant floors, where they have heart transplants, they go to the ICU, then they come to you, to your floor to recover. Really cool job. Open heart surgeries. I worked at a facility where they had specifically an ICU dedicated to open heart CABG patients who would have open heart. You would take care of them literally after they come straight out of surgery. They bypassed the PACU and came to you. If you're into that. Congestive heart failure. A lot of patients have congestive heart failure. I worked on one of these floors, and this is where your main patient population are going to be patients who suffer from this disease. Next, you have non-invasive cardiology, which is where I worked in the stress lab, and then you have invasive cardiology. This is like your cath lab, or your EP lab where they go in, do the heart caths. EPs, you can work in the holding area where you're prepping them, getting them ready, getting everything prepped, and then, or you can work in the cath lab where you're actually assisting the physician or the team by documenting, you're giving medicines, you're dealing with any code blue situations, and you're there for the patient. Or you can go into electrophysiology. This is another neat career to go into. It's called an EP nurse. This is where a physician will go and they perform ablations because a patient has a certain part of the electrical conduction system of their heart that's acting not right, and they go in and ablate that and hopefully fix the problem if they're having supraventricular tachycardia, things like that. So if you're interested in that, that might be something you want to check out. Now let's talk about the educational requirements. How do you become a cardiac nurse? Is there some specific school you have to go to? No. Only thing you have to do is you have to go to nursing school. You can go through an associate's program or a bachelor's program, ADN or BSN. You graduate, you take the NCLEX, you pass your NCLEX RN exam, and then you get a job on a cardiac floor, cardiac focused floor, to learn the trade of how to be a cardiac nurse. So what you do is you get on the job training. And how I done it was that went to nursing school, passed the NCLEX, and I actually done an internship during the last semester of nursing school. So if that's offered for you, I really recommend you look in the hospitals and see if they have internships for nurses who are in their senior year of school, because this gets your foot in the door, hopefully gets a position that you want. And I got a job on a progressive care step-down floor, which was congestive heart failure focus. And after I graduated, I became an RN on that floor, and I learned the trade of cardiac nursing. And I learned how to do EKGs. I learned everything about atrial fibrillations, heart attacks, medication management, aquapheresis. And then after that, I went, because I got that experience, worked there for about 3 years, and then I went to the non-invasive, the stress lab, and absolutely loved it, and worked there for about 3 years doing that. So that's what you need to do. So whenever you graduate, if you want to go into cardiac, just whenever you get on the hospital's website or wherever you want to work, I really recommend you start out in a hospital, because you are going to see a lot of awesome, cool things, and you're going to increase your knowledge. Apply for floors, because it normally says in the job description what the focus of the floor is, and try to look at anything that's cardiac related so you can build that foundation and go wherever you want. If you want to start out working in a stress lab or a heart cath lab, things like that, sometimes I have seen heart cath labs hire you straight as a new grad there to work, but typically they want you to have that floor experience, that basic nursing knowledge before you go and work in those settings, because those settings require that you have that foundation to know how to do those things. Because whenever I worked on the floor as a progressive care nurse with congestive heart failure, and then I went to the stress lab, I've seen how if I didn't have that progressive care cardiac foundation already in the stress lab, I'd probably been really confused and wouldn't been able to understand a lot of things I was doing at first. Okay, now let's talk about the certifications you can get. Any specialty has a certification. So if you want to go into renal nursing or wound care nursing, there are certifications for it. And you can get certified through the American Nurses Credentialing Center. They have a website. If you Google ANCC, and you can see what the requirements are for that. But cardiovascular nursing does have its own little thing, and you'll get to put the initials, your last name, RN-BC, which is board certified, meaning you're board certified in cardiovascular nursing. But you can't just graduate from nursing school and then go and get the certification. You have to meet some requirements, and requirements for that is that you have to be a nurse with clinical experience for at least 2 years. You have to complete at least 2,000 hours of clinical experience. That's a lot of hours. You have to complete at least 30 continuing educations of cardiovascular material a year. And you take an exam, and then you have to renew it every 5 years. But why would you want to be certified? What's the whole purpose of it? Well, employers really like this. And the place where I worked, if you had certification, you got a higher pay grade and you made more money, and it makes you look more, say you're dying to work in the ICU as an open heart nurse. That's going to look really good on your resume compared to someone who's not board certified. So that's definitely something you want to look into if you want to go this route. Now let's talk about salary information. According to BLS.gov, the Bureau of Labor Statistics, the average registered nurse salary nationally, this is not individually for states, this is just nationally. If you want to see how much you'll make in your state specifically, go to the description below. There's a link that'll take you to that page so you can see that. But average is $69,790, and this is all the nurses together. It's not just new grads, it's nurses who have experience and everything that's all together, and they've added that up. Or $33.55 an hour. Now, let me talk about what I like about cardiac nursing and what I don't like. Just like with everything, you're going to have things that you absolutely love and you're going to have things that you just don't like. That's just life. So let's talk about likes. One thing that I really like is that the heart doesn't change. It is specific. You can learn it. It has certain parts of it. It's easy to learn, and once you learn it, you got it. It doesn't change. It's there. And cardiac nursing, I think personally, offers the most opportunities to specialize and go in different directions than any other specialty out there. Because like I said at the beginning, you can work in a stress lab, you can work in a cath lab, you can go work on a congestive heart failure floor, you can go work in an ICU that does open heart surgeries. It's such a wide variety of things that's offered to you, and you can advance in your career. Next, it affects so many people. Cardiac disease is one of the things that affects most Americans in the U.S. So whenever you're caring for these people, you get to impact their life, and it's a lot of people you're going to be impacting, and you can hopefully help them manage this disease better, help them with diet changes, and you can really see an impact that you're doing for these people's lives. Another thing that I absolutely love, my most favorite, is that the technology is absolutely amazing. From where I started becoming a nurse like several years ago till now, technology has already changed, and it's so cool. And getting to see how, hey, we did it this year 5 years ago, now we're doing it this way and better outcomes. And the example of this is in the cath lab. As I talked about before, cath lab, they look for any blockages in your heart. Well, they normally would go through the femoral artery, which is risky. You have chances of bleeding, bruising, a lot of issues. And then post-op, you have to lay flat. Patient usually has to stay overnight, things like that. But now they have developed technology where they can go in through your wrist artery, which is majorly decreasing patients having to stay in the hospital longer, decreasing chances of bruising, bleeding out, things like that. And it's just really awesome to see that. And what are we going to see in 10 more years? So it's just an awesome field to see the technology changing. Now, let me talk about the dislikes, what I didn't like. One thing is that it can be very stressful because you're dealing with the heart, which is a vital organ. If our heart doesn't work, the person's dead. So whenever you're dealing with something that's so important, so specialized, and you have issues, you're probably going to have a little bit more code blues. You're going to have some issues because the heart is very vital. Next, another thing that is sad that it's sometimes hard to deal with is that a lot of patients don't get better because congestive heart failure, other heart diseases, you're stuck with that. There's no cure for that. And so it's really hard on the patients, it's really hard on their family, and it's hard to manage. And you have them, they keep coming in over and over, and you form this relationship with them. And then you see them pass away, you see them die, and it really affects you, and it really makes you sad because you have seen that person from the time they got diagnosed all the way to the time they drew their last breath. So it can be sad and hard on you. So that is a little bit about cardiac nursing. I'm biased, of course, because I love the field. I think it's an awesome field to go into. So I hope you consider it, and I hope I helped educate you about what they do, salary information, everything like that. And thank you so much for watching, and be sure to check out our other nursing specialty videos to see what you're interested in. Or you can go to our website, registerednursern.com, and take a personality quiz based on your personality and see what jobs fit who you are. So thank you so much for watching, and please subscribe to this YouTube channel.